right. Welcome to Medication Monday, Dr. Pejic.
Hello.
Hello. I have a new medication I'd like to discuss with you.
Sure, bring it on.
What can you tell us about Seroquel?
Seroquel. Seroquel is an anti-psychotic, and it's also a mood stabilizer. It's very commonly used to treat bipolar disorder, schizophrenia, schizoaffective disorder, and interestingly, Seroquel XR, the extended release, is FDA approved for bipolar depression. So one of the reasons why we use it. It's a sedating medication, so we often prescribe it right before bed. And it can also be used for treatment-resistant anxiety off-label, meaning the FDA did not approve it for such, but we sometimes use it for that. Yeah, there's all kinds of things I could tell you about Seroquel.
So as far as using it for anxiety, how would someone know if that would be a good choice for them to use it off-label? When do you know when to use something off-label?
Well, that's really in the doctor's control or in their kind of internal algorithm of what we do. If someone's really not getting well from the usual suspects, like Lexapro, Zoloft, Effexor, those types of medications, sometimes we have to bring out these medications like Seroquel because they work differently. So if someone's not getting better with one mechanism via serotonin, then you may use another mechanism. So Seroquel kind of fits the bill for that. Also, a lot of folks who are anxious have trouble sleeping. So I might add this alongside something like Zoloft or Lexapro to help someone sleep and to augment their anti-anxiety response. The other thing I would say too, sometimes you can use Seroquel during the day, although it's sedating. It can also lower your blood pressure rapidly if you take too much of it too soon. So you have to like slowly inch it up. But I have some folks who take it a few times a day, maybe 3 times a day, once in the morning, once midday, later in the day before bedtime. And you usually dose the largest dose right before bedtime. And you use kind of smaller baby doses throughout the day. Some folks do that. But again, these medications, if they're sedating and they make you feel too tired, it can be a no-go because it just, the person can't function so well. So you have to kind of carefully, just have to be careful about that. This medication can also cause some weight gain. And that's one of the drawbacks of it. And one reason why I won't use it all the time. However, there's new medications that help with weight gain. So if I have patients that really do well in Seroquel, then sometimes we'll get them on a weight loss medication alongside of it so that they can have good quality of life and not gain a ton of weight.
So is Seroquel something that a patient could use long-term, or is it something that's good for a couple of years and then they'll need to switch to something different?
Usually it's a longer term medication because some of these illnesses are chronic disorders such as bipolar disorder or schizophrenia. So you would want to take it for long term. Yeah.
And what is it like if you decide to stop Seroquel? Is it one of the medicines that you can stop immediately and switch to something different if it isn't working? Or do you need to kind of slowly get...
Yeah, with most medications, you would want to taper down and have that discussion with your doctor. One of the reasons you have to taper down in Seroquel is that it has some anticholinergic side effects. Those are side effects where you get dry mouth, maybe dry eyes. Sometimes you get urinary retention with something that's highly anticholinergic. That's where it's like trouble generating a stream of urine. But when you're tapering off, you get the opposite of that. So sometimes folks will salivate excessively, or they may have gastrointestinal upset. So usually you want to do kind of a slow taper back. Also, what I like to do too is if we're going to taper somebody off of something, I like to see how they're doing either week after week or month after month on the lower doses. Unless you were going to rapidly jump to another medication, then there's something called a cross taper where you lower one medication while starting the next one. And so for a 2 to 3 week period of time, someone might be on both medications. One is being reduced and one is being increased. And there's a way doctors do that in an artful, manner. The one last thing I'll add about that is these medications can cause movement disorders where you can get an involuntary mouth twitching or tremor in your hand. And the reason that happens is from blocking dopamine, which can sometimes be helpful for certain conditions. But if you block dopamine too strongly, you can get all this movement disorder features. And some of that can be permanent if you're on medication. So you have to tell patients that that's the case. And if they're having any of those problems, the doctor has to be on the lookout for it so they can tell their patient, because the patients don't always notice that their mouth is twitching. It might be very mild in the beginning, but then we need to know to tell them so that if you're not going to continue it with the idea that that twitching can get worse, then you have to bring it up and then have the conversation about switching the medication. Seroquel, compared to the other medications that treat the conditions I had mentioned, it doesn't push on dopamine as much. So it's a special medication that can be used if you really want to avoid causing someone muscle twitching. Although it could still happen technically, it's just not as, the rate of it's probably lower than not. Yeah.
And so if Seroquel is working for a patient, what will they experience? How will they know that this is doing its job?
Well, it depends on what you're treating. So for schizophrenia, someone would not be hearing auditory hallucinations, which is like folks who have that will hear an actual voice that's not their own, and it's being manufactured in their mind. And they will hear someone talking to them, saying things to them, which can be scary and disruptive, obviously. So those things would be lower volume, less intense, less frequent, if you're on the right dose of Seroquel. Sometimes you can eradicate that, which is good. Now, if you're treating bipolar disorder, which is high highs and low lows and in-betweens, Seroquel would modulate that to where someone's sleeping well, that they're not dipping down, their moods aren't dipping down as badly or at all, and their moods aren't getting too high to where they're manic or what we call hypomanic. So those are two phases of the same illness that we will treat. And then beyond that, I think we talked about anxiety as well. So someone would just be more in control of their worrying and and of their emotions in general.
Okay. Well, thank you for sharing this information.
Yeah, absolutely. It's a good medication. It's helped a lot of patients out.
Excellent. We'll see you next week.
All right. See you next week. Bye.
Bye.